Hi, I'm Dr. Sabrina Shah Desai, an aesthetic oculoplastic surgeon based in London on Harley Street, and I'd like to talk to you about droopy upper eyelids or eyelid ptosis. Now, droopy eyelids occur very commonly as we age, but they also can present congenitally, so you can be born with it or there can be a familial history, or occur because of trauma or other neurological conditions like a third nerve palsy and Horner syndrome, and even certain myogenic conditions such as myasthenia. Interestingly, droopy eyelids can also occur because of chronic contact lens wear or following cataract surgery or even laser refractive surgery. Now, once you have a droopy eyelid, it affects your field of vision, so you actually walk around as if you have blinkers on your upper eyelids. Now, how do we correct a droopy eyelid? Most patients who present with a droopy eyelid are expecting a scar across their upper eyelid, which is hidden in the skin fold. And this is a traditional method of correcting droopy eyelids. But in my practice, I have now moved to a scarless technique, and I reserve the traditional approach if the levator function or the muscle function is weakened. So here we make little cuts on the front of the forehead and we use a sling to help lift up the eyelid, and this is if the muscle function is really poor, and this is called a frontalis suspension. But if the muscle function is moderately good, then we can make a cut directly on the eyelid and tighten the levator muscle, which is the main muscle that lifts up the eyelid and is attached to the firm part of the eyelid. Now, there is another smaller muscle called the Miller's muscle that actually attaches this levator muscle to the firm part of the eyelid, and this is a great method of testing whether you could have the scarless approach. The scarless droopy eyelid approach is where the cut is actually hidden inside the upper eyelid, so there's nothing to see on the front of the skin. But I tend to reserve this approach for people who do well with a diagnostic test called the phenylephrine test, which is a drop test that I perform when you come and see me in clinic, and this tightens the Miller's muscle. So I prefer the scarless or no scar ptosis surgery as it gives highly aesthetic, natural looking results. Now, depending on the cause of ptosis, surgery can range from a simple 30-minute procedure to a more elaborate 90-minute procedure. Recovery times are generally quick, most patients achieving good recovery within 14 days. I hope this little video has answered your questions on droopy eyelid repair. If you have any further questions, please don't hesitate to contact my team at Perfect Eyes Limited or visit my website. I look forward to seeing you.